Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. Today, I'm discussing stem cell therapy for autism in Africa. R3 now has a beautiful, first-rate stem cell treatment clinic right in Johannesburg, South Africa, in the Melrose suburb. I brought a couple friends with me today. This is Plushie. We like to give these to children who come in for autism therapy. Very soft. And I also just brought a brain so we can talk a little bit about autism and what's happening. So Autism Spectrum Disorder has really been a new umbrella term that has been put forth that encompasses not just autism, but also Asperger's syndrome and pervasive developmental disorder. So when you look at the incidence of autism around the world, it's really gone up and up and up and up. In addition, pediatricians and medical specialists are much better at diagnosing ASD than ever before. So ASD diagnosis is at an all-time high, and what we hear time and time again is parents telling us that, look, our child who's been diagnosed with ASD, whatever level that is, they've been through occupational, behavioral, and speech therapy, and maybe also they're on one of the traditional medications, and initially they got better, but then they sort of hit, the proverbial brick wall. So what can be done? Well, for the last 9 years, we've been performing stem cell therapy for autism, and our protocols have gotten better and better and better. Ever since Duke University did multiple clinical trials on umbilical cord stem cell treatment for autism, their results were fantastic. So anybody who tells you, including like your pediatrician or whatnot, that stem cell therapy has no evidence behind it, doesn't work, so on and so forth, that is baloney, because there's a lot of evidence behind it right now. So what's happening with autism? Well, we don't know exactly what causes ASD. But one of the leading theories is that children who develop ASD have increased neuroinflammation in their brain. What does that mean? Well, inflammation anywhere in the body, first of all, is good to a point. Okay? We need inflammation. For instance, inflammation is the first phase of healing. Then you have repair and remodeling. But if you have chronic inflammation in an area such as the brain and the central nervous system, that can be damaging to proper development. What it can do is it can create oxidative stress and something called reactive oxygen species, which can blanket your own repair, regenerative, and developmental processes to where children are not developing the neural connections that they could be otherwise. When we do stem cell treatment for autism, we'll typically do what's called a hybrid procedure. We'll do an IV in a child's arm. Okay, I'm using Plushie here to show you, in the arm. And then we also do an injection into the back, and that's called intrathecal. It's like a reverse spinal tap. Now, I know that's a little bit nervous to hear about that. However, we do sedation on children, conscious sedation, not general anesthesia, where the children don't feel pain and they don't remember any of it. So it's something that we do all the time. It's been very, very safe. Knock on wood. We've done it over 1,000 times. And it's one of these things that we want to avoid the blood-brain barrier that prevents a lot of the cells from getting into the central nervous system in the brain. And the intrathecal injection allows us to do that very, very nicely. If parents are very nervous and they don't want that, that's okay. We can do the IV and still get very good results. Not as spectacular as with the intrathecal, but at any rate, we use a combination of umbilical cord stem cells and umbilical cord derived exosomes. Exosomes are byproducts of the stem cells. It's great to add more than just what you get from the stem cells. So we use millions and millions of stem cells and billions of stem cell exosomes. The exosomes work a little faster, but they don't last as long. So I look at that as the 1-2 punch when it comes to the combination. And the combination of doing the IV plus, I'll use Plushie again, the injection into the back offers up a lot of benefits. Well, what are those benefits? Parents tell us that children are having problems with really two categories. And these are the two categories that see the most benefit: behavior and communication. So let's talk about behavior for a second. Hand in hand with autism, we frequently hear from parents that they are hyperactive in some capacity, okay? Maybe we've seen kids who are literally bouncing off the walls, whereas others are just, slightly hyperactive and irritable. They don't maintain good eye contact, they don't have good attention span, and sometimes they get aggressive with friends, family, even themselves. The communication side of things kind of spans. We have some who are very high functioning, but they don't have a high vocabulary. It's almost like they know that they want to say something, but they just aren't, getting it out. Whereas others really don't speak at all, and they're very smart children. They just don't actually have, vocabulary. So what we see with the stem cell treatments that we do is better behavior as far as reduced hyperactivity, reduced aggression, better eye contact, better attention span. We see that frequently. On the communication side, we also see increased verbal and nonverbal communication, and then, like I said, better eye contact. Like, for instance, we hear from parents that their kids have less potential to elope, just run. They have better self-awareness. So it's been a fantastic combination between the behavior and the communication with what parents see. We do have several success stories on our YouTube channel of parents describing, and actually you can see some of the children in those videos, and the parents are talking about improvements such as, the vocabulary goes up, they get less irritable, they get better attention span. One child, I think it was TJ, he was able to go to school not just for half a day, but for a full day after the treatment. A lot of things like that. Now, typically within 3 to 6 weeks, parents are noticing that there's improvements, and then it continues for months. And then typically we see a new baseline. Rarely we do see a little bit of regression, but not typically. What are the side effects? Side effects may include lightheadedness, dizziness, some nausea, maybe a little bit of vomiting, possibly a low-grade fever, maybe a little back pain from where the injection was done. Now, one side effect that we have seen, and Duke University reported this too, some children actually have increased hyperactivity for about 2 weeks or so after the procedure, and then it usually goes the other way, the way that we want it to go. No two children are alike. We do like to customize the treatments with the amount of stem cells and exosomes, typically based on the weight and the severity of the ASD. Most treatments are done in 1 or 2 days. Once in a while, we'll do a 3-day treatment. People ask us, well, why do you do 1, 2, or 3 day, whereas these other clinics want us to come in for 7 to 14 days? Here's what's happening. We know what the evidence shows for autism treatment with stem cells, but other clinics want to add what I will call fluff into the mix. Hyperbaric oxygen, other peptides and things like that. 1 or 2 sessions of hyperbaric oxygen is not going to move the needle for a child's autism. Studies have been done showing maybe 10 to 20 sessions. So if you come in to our clinic to get treatment and we do 1 session of hyperbaric or maybe 2, that is not going to do the trick when it comes to autism. You need a full series of that. So most parents, they're coming in with their child for the treatment, and then they're going back home. That is where hyperbaric oxygen should be implemented, right? So adding this fluff and also doubling the price or things that bump up the cost doesn't make sense to us. We like to be very safe, very effective, and affordable. So if we wanted to, yeah, I could add in multiple more days, but that's time out of work, time out of school. It doesn't make sense for us. We know what works well, and that's what we've implemented. Visit us online today at r3stemcell.com. Now, there's a drop down for the South Africa website. There's a free download consumer guide on stem cell treatment for autism, and then we offer free consultations. As the world's largest provider of regenerative therapies, I love the fact that we can now offer, I guess what you would call is local-ish treatment to people in Africa and South Africa, right? You don't have to fly to Mexico. You don't have to go to Panama or China or these other places. We're right in South Africa. Okay? You can email us, info@r3stemcell.com. Call us at the number listed below, and we'll give you a free consultation to see if your child is a candidate for stem cell treatment for their autism. Thank you.